Simplified summary, Trimethoprim. Mechanism of action. Blocks bacterial dihydrofolate reductase. Rightward arrow stops folate synthesis. This slows DNA production. Rightward arrow bacteriostatic. Often combined with sulfamethoxazole, TMP-SMX, to block folate synthesis at 2 steps. Clinical uses, TMP-SMX. Urinary tract infections, UTIs. Shigella and Salmonella. Pneumocystis jirovecii pneumonia, treatment and prevention. Toxoplasmosis prophylaxis, especially in HIV patients. Side effects, mnemonic, TMP equals treats marrow poorly. T. Thrombocytopenia, downward arrow platelets. M. Megaloblastic anemia. P. Pancytopenia/leukopenia, downward arrow white blood cells. Hyperkalemia, especially at high doses. Side effects may improve if given with leucovorin, folinic acid. USMLE Question 1, Mechanism and Combination Use. A 25-year-old woman is diagnosed with a urinary tract infection caused by E. coli. She is prescribed trimethoprim sulfamethoxazole, TMP-SMX. Which of the following best explains how these drugs work together? A. Both drugs increase bacterial cell wall permeability. B. TMP increases DNA gyrase activity while SMX inhibits RNA polymerase. C. TMP inhibits DNA synthesis and SMX causes DNA strand breaks. D. TMP and SMX block different steps in bacterial folate synthesis. E. TMP inhibits bacterial protein synthesis and SMX blocks efflux pumps. Correct answer, D. TMP and SMX block different steps in bacterial folate synthesis. Explanation. A. Cell wall, incorrect, these are not cell wall, active drugs. B. DNA gyrase/RNA polymerase, fluoroquinolones and rifampin target these. C. DNA damage, not the mechanism here. D. Correct. SMX inhibits dihydroaptate synthase, TMP inhibits dihydrofolate reductase. Rightward arrow sequential block of folate synthesis. E. Protein synthesis/efflux, not involved with TMP-SMX. USMLE Question 2, Side effects and prevention. A 50-year-old HIV-positive man is taking TMP-SMX for pneumocystis jirovecii prophylaxis. He develops fatigue, low white cell count, and megaloblastic anemia. What should be added to his regimen to reduce these side effects? A. Iron sulfate. B. Cyanocobalamin. C. Erythropoietin. D. Leucovorin. E. Folic acid. Correct answer, D. Leucovorin. Explanation. A. Iron sulfate, for iron deficiency anemia, not helpful here. B. Cyanocobalamin, vitamin B12, used in B12 deficiency anemia. C. Erythropoietin, stimulates red cells but doesn't fix the folate block. D. Leucovorin, correct. Folinic acid bypasses blocked folate enzymes and helps restore bone marrow without interfering with TMP's action. E. Folic acid, not as effective because TMP also blocks its activation.